What is a referral? There are many kinds of health plans, including HMO, PPO, commercial, or self-pay. The referral process was introduced to ensure proper communication between your primary care doctor and specialist. It is meant to be a collaborative decision between you and your primary care physician. It usually involves a discussion between you and your physician about the medical problems. Primary care should provide you with the possible options for referral to an appropriate specialist. Your primary care office must communicate with your specialist about the reason for a referral. They should provide the specialist office with clinically relevant clinical notes, recent labs, radiology results, and other necessary information empowering your specialist to assess your condition correctly and efficiently. You get quick, comprehensive, and cost-effective care in this coordinated care model. Why does your insurance require referral? Your insurance intends to pay for only appropriate care and ensure you get the best care from the best specialist. Most of the inappropriate care cost is due to medically unnecessary consults, procedures, routine follow-ups, and duplication of services. Your insurance enforces proper communication between your PCP and specialist office so that you get the best care. You also become involved in the decision-making process about specialty care, allowing you to make your health care. You choose your specialists within the network. You have a voice in where your health care dollars are spent. This empowers the patients. The referral is a communication tool and not another kink in the system. A referral requirement leads to shared decision-making between the patient, primary care, and insurance. Your PCP and insurance have all the information to decide on medical necessity and quality of care. Your primary care office should be your medical home, providing most of the care and coordinating the rest with other health care providers. Your primary care office should provide open access, urgent care, walk-ins, same-day appointments, and televisits to coordinate acute, chronic, and preventive care. The patients have lost faith in their primary care physicians, and they end up coordinating their care, leading to duplicate and unnecessary care. What is a good referral process? There should be a discussion between a patient and primary care to determine the need for an appropriate service. Your PCP office should coordinate with health insurance to obtain authorization, so you do not have any extra costs. Your PCP office communicates on paper or electronically to your specialist with the authorization number, medical summary, and laboratory and radiology reports. You are informed about the referral's progress and provided with the necessary information. It is prudent that patients should inform the specialist about their PCP during specialty visits and request to send the information back to the primary care office for continuity of care. Medicare wants you to evaluate the efficiency of health care service. Medicare sends yearly surveys to the beneficiaries to evaluate the services, and the patients should provide honest feedback to assess and rank services properly. Medicare uses the star rating system based on many measures to determine the quality of care delivered. Ask your primary care office for their star rating. How does Shield Medical Group excels in referral process? The reliable referral process is the only difference between good and bad primary care office. We have a very reliable referral process. We will solve all aspects of the referral process to ease your mind. Shield Medical Group pledges to complete the referral within 48 hours, and we will communicate with you clearly about the progress of your referral. Quick, comprehensive, and cost-effective is the only solution for better quality and healthcare outcomes.